lot of buzz is going on regarding the new Next Generation NCLEX. As this is a new approach and most of the books and resources have been prepared according to the old NCLEX, students have a lot of confusion regarding the difficulty, question types, and how to prepare for Next Generation NCLEX. In this video, we will learn about this topic in detail. Before moving on further, let me remind you for a quick enrollment in the free NCLEX preparation crash course if you have not already done so. There we will study the important topics that could be helpful for your NCLEX art and preparation. The Next Generation NCLEX will start on April 1, 2023. When NCSBN performed a survey regarding knowledge and skills required for the nursing practice, it found the necessity for better clinical judgment by the nurses. So, for this purpose and to reflect the measurement of the candidate's clinical judgment, some format of the questions are changed in the Next Generation NCLEX. However, please be sure that the contents to be studied are the same for Next Generation NCLEX too. So, the books that you are studying now will be equally helpful for preparing Next Generation NCLEX too. Please also refer to the section in this lecture where I have pointed out the differences between the current and Next Generation NCLEX. It depends on the type of questions you encounter and find easy in NCLEX. The scoring method for Next Generation NCLEX is quite different from the NCLEX before that. For example, if you select single wrong option and select all that apply type of question, you won't be scored in NCLEX before the Next Gen. However, in the new format, you will be partially scored for all the correct options that you have chosen. Please also keep in mind that there is a plus and minus scoring system in Next Generation NCLEX. Candidates can also lose marks for selecting a wrong option. However, even if more wrong answers are selected instead of right, the candidate won't receive marks in the negative whole number. The Next Generation NCLEX will have a minimum of 85 questions that is 70 scored and 15 unscored questions. Here, for 70 scored questions, 52 will be standalone questions and 18 case study related questions. There will also be maximum of 150 questions with 135 scored and 15 unscored questions. The scoring methodology in the Next Generation NCLEX ARN exam is also entirely different. There is a partial crediting in score in the new generation. That means the questions will not be judged as completely right or wrong. Here is an explanation of the scoring system in the Next Generation NCLEX exam. Plus and minus scoring system. In this system, candidates can also lose marks for selecting the wrong options. While calculating your final score, all the correct answers will be counted and the score is subtracted with incorrect answer score. However, even if more wrong answers are selected instead of right, the candidate won't receive less than 0. Zero and one rule. In this rule, when the candidate answers a question correctly, he or she will get 1 mark or 1 score. And when the candidate fails to answer the question correctly, he or she will get 0 score. However, for questions that ask for paired information or any relational information, for scoring 1 point, both options must be correct. If one option is wrong, the question won't be scored. Also, for questions that asks for order, the entire order must be correct. Take these examples. Which of the following patient conditions can be worsened by following procedure? Or, arrange the order of the procedure type of question. You have to answer each option to get full marks in such question. Let's see the similarities between the Next Generation NCLEX and NCLEX before that. Candidates will have 5 hours to complete the exam as the previous one. Candidate performance report format will be similar for Next Generation NCLEX with a slight difference as this time. The report will contain score of the clinical judgment. Further, the score will be broken into 6 topics such as recognize cues, analyze cues, prioritize hypotheses, generate solutions, take actions, and evaluate outcomes. The delivery method will also be the same. It will be CAT or computerized adaptive test format in which the difficulty and the length of questions and exam duration will depend on the individual performance of the candidate. Case study type questions. The Next Generation NCLEX will contain case studies with some clinical scenarios which will be accompanied by 6 questions. There could be information on health history, nurse notes, lab values, and information on the vital signs of the patient. The right-hand side of the screen contains questions with options you have to choose from. As you answer the question, Next Question appears on the right-hand side, which is associated with the same case study given in the left-hand side of the screen. The questions following case study will cover skills such as recognize cues, analyze cues, prioritize hypotheses, generate solutions, take actions, and evaluate outcomes as discussed before. Here, in the screen you see a case study at the left-hand side. There can also be other tabs and information related to the case study. For instance, you can also click the tabs like patient history, nurse notes, laboratory findings, etc. On the right-hand side, you see a question with options. As soon as you select the option, you can get the next question of the same case study, so this case study part on left-hand side of the screen will remain same, and following that case study, you have 6 different questions on this right-hand side. I hope with this example, you have now a good insight on what the case study question means. Let's move further. Please note that the Next Generation NCLEX will also have the following new types of questions. These are usually the standalone type questions, which are not related to case studies. Extended multiple response type questions. Extended drag and drop questions. Cloze or drop-down questions. Enhanced hotspot or highlighting type question. Matrix or grid type of question. Extended multiple response questions. These type of questions contain multiple options or multiple answers for a single type of question. In the Next Generation NCLEX, the number of these types of questions and options of multiple choices may increase, but there is no need to worry with this, as we know that there is a partial marking system in the Next Generation NCLEX. You get marks for all the right options selected, unlike previous system where candidates get 0 marks even when a single option selected was incorrect. Here on the screen you can see an example of extended multiple response questions. Here, 2 or more than 2 options could be the right answer, but there are too many options provided. This is what we mean by extended response. You should expect to see such questions in the Next Generation NCLEX. For extended drag and drop, instead of clicking all the right options, which could be multiple right options, you have to drag and drop the right options in the space provided. Here, I have provided an example of extended drag and drop question. You have to drag and drop the options according to priority. These types of questions can often be used to prioritize the nursing steps that should be taken. The Cloze type of question tests the nursing priorities. You will be given a report where there are drop-down options among which you have to choose any word or phrase that may require immediate intervention or is asking for any actions. So, basically, the Cloze asks you to choose between different options from its drop-down menu. It's like filling in the blanks with options already given to you. Here, in this example, you are given a paragraph and you have occasional spaces where you need to choose between different options from the drop-down menu. In the new exam format, you can also see a matrix table, which could be presented to you in an Excel sheet or in any matrix form. The column will contain any information on patients' conditions or actions of nurses. The other 3 columns will contain the options for correct and incorrect answers. We will have to select one option from each of these columns. Here, in this example, you have to choose if the nursing assessment provided on the left-hand side will be effective, ineffective, or unrelated to the condition given in the question. Basically, as this single question contains many questions, you can expect this type of question in the case study question format too. Highlighting. In this type of question, the answer has to be selected by highlighting the text or sentences. You may see a part of medical report, which could be medical or patient history, and then you have to select or highlight the words and phrases inside that resemble the need of the question. Basically, it's searching for right answer within the text given. The answers are already in the question or text given to you. You will just have to locate them. Here, in this example, a nurse note is given, and you have to select the statement or any text inside this note that requires a follow-up. So basically, these are all the points you should be watching out for preparing for the Next Generation NCLEX. Of course, there will be other types of questions, such as fill-in-the-blanks type question, figure questions, multiple choice questions, matching the options question in the Next Generation NCLEX too. For more information on all the type of questions, and for quick practice and learning the important topics, I have provided a link of free crash course which you can join from the link given. We select only 100 students each month for a full scholarship, so first 100 students will be awarded with link of free NCLEX RN crash course. Please fill in the form given to you from the link in the description. Thank you so much for joining and staying with me so far in this lecture.